Hey there, let's take a look at some psychological therapies. Depending on who you talk to, psychological therapies can be categorized under broad categories, smaller categories, subcategories, all sorts of things. So do think about how different therapies align with various categories, but don't get hung up on how they're categorized here or anywhere else. Most therapies serve more than one theory, practice, and they belong under more than one category. Psychoanalysis and psychodynamic therapy is where almost all therapies fit underneath. However, sometimes we look at different things through the lens of behavior, cognitive behavioral, and what have you. In any case, psychoanalysis and psychodynamic therapy, let's talk about it. So, psychotherapy helps a person become aware of automatic ways of thinking that are inaccurate or harmful. So, for example, someone has a low opinion of their self or their abilities, and then they question those thoughts, understand how the thoughts affect their emotions and behaviors, and change the self-defeating behavior pattern. So, some of the main focuses in psychotherapy are identifying ways to cope with stress and develop problem-solving strategies, examine interactions with others, and teach social and communication skills, apply mindfulness and relaxation techniques such as meditation and breathing exercises, track emotions and behaviors to raise awareness of their impact on each other, and use supportive counseling to explore troubling issues and receive emotional support. Creating a safety plan to help with thoughts of self-harm, suicide, recognizing warning signs, using coping strategies like contacting friends, family, or emergency personnel. Those are things that happen in psychotherapy as well. If you notice, I also mentioned counseling. So psychotherapy is something that a psychiatrist does. Counseling is something that a counselor, psychologist, licensed social work do. So psychotherapy can have a little bit more of a clinical aspect to it, but it doesn't have to. It really depends on your provider. Psychodynamic therapy might be a new term for you guys. It is considered kind of its own category, but at the same time, it can sort of be lumped in with psychoanalysis for a couple of reasons. Psychodynamic therapy focuses on a dynamic of a person or a situation that person wants to change. So a person might want to change one aspect of their identity or personal narrative, or personality, give up a habit. So this can happen more easily when the therapist helps the client reveal unconscious content within his or her psyche. So some dynamic approaches are that during a session, a therapist and a client discuss emotions, thoughts, early life experiences, and beliefs, and this is done with open-ended dialogue and questions. Part of the process is recognizing, acknowledging, understanding, and expressing, then ultimately overcoming the negative and contradictory feelings and possibly repressed emotions. The patient commits to deeply exploring and analyzing earlier experiences, to tie him or her to present emotions and relationship patterns. With help from the therapist, the client can change his or her recurring thought patterns, let go of those unhelpful defense mechanisms and unhealthy relationships. So there are some types or approaches. There's brief PDT, which generally conducted over the course of only a few sessions. This can help victims of trauma, like rape, accidents, terrorism, and other situations similar. Psychodynamic family therapy can be used to help resolve conflicts within the family. Open dialogue therapy, in which information is freely shared by the client. Music therapy also falls under this category, as well as others, of course. And this is where the clients express themselves through music or another form of art, sometimes also while talking. Last but not least, journaling and writing also fits under this umbrella as a way to share emotions, fears, thoughts, etc. If I were going to say one of the most common types of therapy, at least that I hear about the most, it's cognitive behavioral therapy. So this is actually a type of psychotherapy that can help people change their thought patterns and behaviors to improve their quality of life. So CBT is based on the idea that how people think about situations can affect their feelings and actions. It can be used to treat a variety of mental health conditions, as well as emotional concerns, and even some non psychological health concerns. So, things like depression, anxiety, bipolar disorder, OCD, phobias, substance abuse, emotional concerns like grief, stress, and anger problems. And it can also treat the non psychological health conditions like insomnia and chronic pain. So, exposure therapy falls in this category, and it's a treatment that helps people confront their fears and anxiety disorders by gradually exposing them to the sources of their anxiety in a safe environment. This helps reduce fear and avoidance. It can be effective in treating phobias, panic disorder, social anxiety disorder. So, exposure therapy is a safe way for people to learn how to deal with whatever is causing them distress. Desensitization therapy is very similar. It's a type of behavioral therapy that involves gradually exposing a person to a stimuli that triggers a fear or anxiety in order to change their response. The goal is to teach coping tools to help the person stay calm and relaxed. So it has three main steps. You'll learn to relax your muscles. Then you'll make a list of fears and rank them based on how intense they are. Last, you start exposing yourself to your fear in stages so that you can get more comfortable with dealing with that fear. Aversion therapy. This is a type of behavioral therapy that involves repeat pairing an unwanted behavior with a discomfort. For example, a person undergoing aversion therapy to stop smoking might receive an electrical shock every time they view an image of a cigarette. I'm not sure if people actually still do the shocking when they're looking at pictures, but that is an example of aversion therapy. Art therapy falls under behavioral, can also fall under integrative, and like we talked about earlier, a lot of different areas. But this is a distinct discipline that incorporates creative methods of expression through visual art media. Art therapy, as a creative arts profession, originated in the fields of art and psychotherapy, and it varies in definition based on the person that's performing it and based on the overseeing provider who orders it. So, dialectal behavior therapy, or DBT, is a multidimensional approach that can include different types of therapy sessions, techniques, and skill training. There are different types. There's the traditional DBT. This was developed back in the 1980s to treat borderline personality disorder. It has four modules: mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. There is Row DBT, and this type of DBT is for people who have excessive self control, also known as over controlling, and it can also treat chronic depression, anorexia, OCD, and personality disorders. So the sessions include a pre assessment, some individual therapy, group skills training, and actually some telephone crisis coaching. The techniques that are most commonly employed in this type of therapy are mindfulness exercises, learning to deal with crises without harmful behavior, and developing skills to manage relationships and conflicts. The phone coaching that goes along with DBT is a technique that allows the patients to call their therapist between sessions for guidance and coping with difficult physical or emotional situations. So, a couple of ones that I want to talk about that I don't have up on the screen, just so that you guys have a little idea of what they're about, is one is EMDR, and that's eye movement desensitization and reprocessing. This is a form of psychotherapy, behavioral therapy, either one, depends on who you're talking to, that's recommended for treatment for post traumatic stress disorder. It remains controversial within the psychological community. However, EMDR is said to replace negative emotional reactions to difficult memories with less charged or positive reactions or beliefs. By performing a series of back and forth repetitive eye movements for 20 to 30 seconds, this can help the individual change these emotional reactions. Therapists refer to this protocol as dual stimulation. So that's one that I wanted you guys to know about. And also interpersonal psychotherapy, which again falls under the category of psychotherapy with some of those behavioral elements. This is a brief, attachment focused psychotherapy, centers on resolving interpersonal problems and behaviors and symptomatic recovery. It is empirically supported treatment that follows a highly structured and time limited approach, and it's intended to be completed within 12 to 16 weeks. Lastly, there's acceptance and commitment therapy. This is a form of behavioral psychotherapy. It's also a branch of clinical behavior analysis. This is based in evidence, and psychological intervention uses acceptance and mindfulness strategies along with commitment and behavior change strategies to increase psychological flexibility. I think looking into the humanistic approach of therapies is really interesting. Obviously, a lot of these therapies can fit in other sections or whatnot, but to have them grouped together under a humanistic sort of mindset is, I think it's pretty neat, and it also gives a chance to explain them in terms of different theories. So we'll start with person-centered theory. It's also known as person-centered psychotherapy, person-centered counseling, client-centered therapy, and a lot of other different terms. So it's the most popular kind of humanistic therapy, for one. It's also a type of therapy that allows the client to lead the discussion rather than the therapist. The structural shift fosters a sense of trust by communicating to the client that they can work through their problems. It helps them develop autonomy, decision-making skills. So the therapist needs to maintain certain attributes while facilitating this client-centered therapy. They should consistently display empathy. They have to be genuine and engaging. And they have to engage with the client by expressing their feelings honestly, both positive and negative. So next, let's take a look at narrative therapy. And actually, this is a therapy that assumes that events in life are neither good or bad inherently. That people's lives are shaped by their relationships and the stories that life gives us. So with the help of narrative therapy, patients can interpret their experiences as stories that help them make sense of their lives and what's happening in them. This in turn helps them relate their emotions in a narrative way and make connections between their emotions, their actions, and their reactions. So, transactional therapy or transactional analysis believes that positive change in life doesn't come about by understanding our mind, but by understanding the way we relate to others and to ourselves. So, the idea that the therapists tend to work from is that there are three ego states: a childlike, parent-like, or adult-like state. By learning how we behave when in each state, we can start to change how we behave around others so that we get the results that we want in life. For example, learning how to be in an adult state instead of a child state when dating can help you form sturdier relationships. Personal therapy or transpersonal psychology takes psychological methods and concepts and puts them together with spiritual disciplines and practices. So it combines traditional and modern worldviews as well as Western and Eastern perspectives. It employs the analytical and rational intellect, direct experiences, and contemplative or mystical ways of knowing, such as meditation and visualization. It's concerned with the aspects of the human experience that transcend or go beyond the personal level, such as the spiritual realm. It helps a person look past the obvious facets of their identity, like gender, race, body, age, and culture, to discover their deepest core or higher self. Many times, religious and spiritual practices, as well as mystical practices, are integrated into these sessions. This isn't the same as existential therapy, but it's very similar. Existential therapy is a philosophical method based on the belief that inner conflict is a result of a person's confrontation with the realities and paradoxes of life. It views humans' issues like love, loss, death, financial aspects in as being the root of psychological problems. It doesn't offer ultimate answers, but existential therapy optimistically embraces human potential while realistically acknowledging human limitations. So instead of scientifically and objectively evaluating and analyzing an existence, existential therapy advocates interpretation by describing an understanding of things in their order and their essence, and existentially from a higher perspective, living intuitively, passionately, and creatively from the depths of one's being. Experiential psychotherapy encompasses a few direct approaches to psychotherapy, but it typically involves encouraging a client to actively experience and express what they're feeling during a session. So, therapists may be more active in getting the client to focus on their feelings in both the past and the present in order to effect true healthy change. It can involve creative processes such as music and art or interaction with animals to prompt clients towards insight into their deeper thoughts and feelings. So you are working on your mental health through experiences. So next, let's talk about solution-focused brief therapy. This is a goal-directed collaborative approach to psychotherapeutic change that's conducted through direct observation of the client's responses to a series of precisely constructed questions. This is based upon social constructivist thinking. So SFBT focuses on addressing what clients want to achieve without exploring the history and provenance of problems. So these sessions typically focus on the present and the future, focusing only on the past to the degree necessary for communicating empathy and an accurate understanding of the client's concerns. Now, for humanistic therapy, as well as psychoanalysis and behavioral therapy, these are far from all of the techniques and strategies that fall into these categories. This was just an overview of a handful of some of the ones that you may or may not come across, but when you're looking at psychological therapies in general, there are probably more than you could list in, 20 pages. So keep that in mind when you're thinking through these different therapies that we discussed. That's also true with integrative and alternative therapies. There are far more therapies of this type available than what I've listed and what we're going to talk about. Animal-assisted therapy is one of them. This is when patients, this is usually used as a complementary therapy. They are with dogs or horses. They take care of that dog or horse or other animal, and it helps them realize that they are worthy and capable, and it also helps them form emotional bonds. And many times after interaction with the animal therapy, they are more likely to open up to their therapist. Mentalization is really the ability to understand your mental state, your own or others, that underlies overt behavior. It can be seen as a form of imaginative mental activity that lets us perceive and interpret human behavior in terms of mental states. So when we're talking about it in terms of therapy, it involves the ability or learning the ability to interpret or understand your own behavior. So when people are going through mentalization therapy, they are trying to focus or differentiate between their own emotional state of mind and that of others, and then understand how your own mental state influences behavior. Tai Chi is an ancient Chinese martial art that was initially developed for combat and self-defense, but it's evolved into a sport and a form of exercise. It's gentle, low impact, and practitioners perform a series of deliberate flowing motions while focusing on deep, slow breaths. The goal is to bring together the mind and body. It involves certain postures and gentle movements and mindfulness. So the combination of those can help strengthen your body and mind, increasing fluidity in motion, also in mental awareness and thought processes. Acupuncture doesn't have roots in scientific evidence, theories, or practice. However, the results that people have reported with acupuncture have to be taken into consideration, particularly as it applies to mental health. This is a traditional Chinese medicine technique that is used to maintain the flow and balance of your body's energy. As the needles go in, it's supposed to open up those channels of energy and help things flow. It can, in theory, provide pain relief, distress relief mentally, physically, and emotionally, and physical symptoms such as nausea, vomiting, and severe headaches. So, last but not least is hypnotherapy. And this is also known as hypnotic medicine. The efficacy of hypnotherapy is all over the place when it comes to scientific evidence. But the way that it works is the hypnotist or the hypnotherapist opens up your awareness and brings down your level of consciousness, which makes you much more open to suggestion. And it also can help you remember things that you may have suppressed or repressed so that you can work through those. Uh, a, a therapeutic theory or strategy called Gestalt therapy, which is a form of psychotherapy, it focuses on self-awareness and self-acceptance, and it emphasizes creativity and collaboration, uses role-playing, things of that nature. So Gestalt therapy has been used in the past and now in modern day together with hypnotherapy to provide positive outcomes for the client. That's it, everybody. I hope you found this helpful and enlightening. Thanks for being patient, waiting through all of my explanations, and hopefully you can take away a better understanding of psychological therapies.